Hello and welcome to another segment of Western Wisconsin Journal. I'm Jamie Johnson, the political and government correspondent, and it is a political election year. We're in fall elections with the general election coming up November 3rd. And today's race that we'll be highlighting is the 29th Assembly District. And today we have Republican candidate Clint Moses. Clint, welcome to the show.
Hi, Jamie. Thanks for having me on.
And it was great getting to know you a little bit off camera. We have never met before. Found out we have something in common, that we both serve on school boards. And so before we talk, you can let you talk about that a little bit, but, want to talk about what is in your background and your education experience that you feel makes you qualified to run for state representative.
Well, first off, I was in school for a very, very long time. I'm actually a chiropractor here in Menominee. I was in school for about 9 years. Between undergraduate, I have 2 bachelor's degrees, then I have my doctorate in chiropractic. So spent a lot of time paying tuition and being educated. And I'm one of those guys, if I could have afforded it, I probably would have stayed in school longer. But at some point, you got to get out to the real world and start making a living. So yeah, I've got experience. I served on the Menominee School Board as the board clerk here. I've been on the board for about 2 years. I've been the clerk for the past year. Been certainly interesting, challenging times with the COVID situation, being on a public school board. So before that, I had quite a bit of affiliation. I served as a vice chairman for our Dunn County Republican Party. So I've got quite a bit of political experience. Attended a number of 3rd congressional district events and that type of stuff over the last decade and stuff too. So always been very interested in politics, very interested in my community. I've served my community in a number of ways, being on a lot of different boards. I'm the past chair of the Community Foundation of Dunn County, so I've got a lot of experience with our nonprofits and leading meetings and setting policy with our nonprofits as well. So beyond that, yeah, I just felt like now was the time to get involved. You can see the challenges that our country's facing, our state is facing. It's only going to get more and more challenging, I feel, over the next year or two. So I thought now was a very good time for me to get in and get involved and help my community.
Okay. What about family? Do you have family from Wisconsin or roots in Wisconsin?
I do, actually. I grew up right here in Menominee. My dad did some dairy farming between Eau Claire and Mondovi. He was also an ag and industrial arts or a shop teacher. So my dad was a teacher and farmer. And then my mom was a social worker for Dunn County Human Services for about 32 years until she retired over a decade ago already. But so I've got quite a bit of experience with mental health and some of the challenges that our social workers are facing as well. My wife, Nora, and I, both from Wisconsin. My wife is from the other side of the state over by Stevens Point, a little town called Hancock. And then together we have our 4 daughters. So that's the other thing I left out about getting involved in the school board. I do have some individual or personal motive in that I have 4 daughters in our public schools. I have a daughter that's a junior, a daughter that's an 8th grader at our middle school here, and a 4th grade and a 1st grader. So all girls once again. So I'm up for whatever challenge the legislature has to throw at me, because I can handle dealing with them at home. I should be in pretty good shape down there. So
that's a lot of estrogen.
It's growing by the day.
So you have a 1st grader all the way up to a junior.
Yep.
So you've had kids at all levels. And so what do you think of your service on school board so far? What's the most interesting thing or thing maybe you didn't know so much about that you've learned about since being on?
There is a lot that I didn't know when I got on there. I guess I didn't really know what to expect. I thought we'd be doing quite a bit of policy, and we do policy, but it's like any other business. The school runs like a business. Obviously, our end product is educated students that care about our community and are ready to either hit the workforce or go on to further education. So there's a lot of behind the scenes stuff that has surprised me. Not so much the human resource stuff, because as a small business owner, I deal with a lot of that myself, but just how our schools are funded and what formulas go into that and all these different, mainly the funding is probably the biggest surprise I've run into, is how our schools are funded. Beyond that, just the dynamics of working on school board. I've been on a school board where I've been kind of in the minority in a 4 or 5, and the last year I've been on the other side of that where we have a majority. And the school board is much more partisan than I guess I thought it would be. It doesn't necessarily surprise me, but I think that sometimes hinders how much we can get done at the community level. And honestly, I could apply that right up to the state. I think A lot of times our legislature, they're not in session as many days as they maybe could be because we have a GOP-held legislature, which I'm one of them, and a Democratic governor. So I'd like to see more cooperation. I'm one of the guys, I think I can work across the aisle. I'm pretty safe to listen, safe listener. It comes with part of my field. In my practice each day, I have a variety of different clients come in. A lot of them may not agree with me politically, but they feel safe talking to me about issues in our community. So I'm very optimistic about my ability to serve the people of the 29th and serve them well. I have a number of ideas, a number of things that I'd like to see happen. I don't plan on going down there and just sitting around. I'm one of these guys, I've been blessed. I've got a very good business. I have a great family. For me, it's a sacrifice to serve in the legislature. I do it because I care about the people in this area. I care about our state. I care about our country. This is not the highest paying job I've ever had financially. That's not why I'm doing it. I have a full-time job. I'm used to working 55, 60 hours a week between running my chiropractic practice, dealing with my student rentals, and I also run a small farm where we raise beef and sheep. So I'm already a very, very busy guy, but I have a lot of broad experience. So I think I can really bring a lot to our state legislature that, quite frankly, the other side doesn't bring.
Okay. When you say the other side, meaning your opponent?
My opponent.
Okay. But you mentioned about being willing to work across the aisle. What are some of the things that you think that, and you said it starts with listening, being a safe listener, if you will. And I think I agree with communication starts with listening, but what would be an issue or two that you think you could actually make some headway in what seems to be almost endless gridlock down in Madison?
Well, there's a couple that really hit close to home that I've got a lot of experience with. Like one of them is any willing provider. And any willing provider would basically allow a patient to be able to go to the provider of their choice and not necessarily be hindered by the insurance network that they're in. The reason I think that could be a pretty bipartisan one, but the reason that one is really important to me is up here in Menominee, we've got UW-Stout. Well, UW-Stout draws students from all over the state and beyond. We get students that come here from Minnesota and Illinois, and some of them have regional plans, PPO plans, that limit them to providers within their region. So they come into my office, and it doesn't matter which of the providers here that they see, they have no coverage. They don't have any coverage anywhere in our community, anywhere in the 29th, anywhere in Menominee. So any willing provider would free that up a little bit. I think there's a lot of stuff with our healthcare system that could be improved. Quite frankly, I think our Medicare system that we had prior to Obamacare was a little bit better system. I think our state had a good system in place. It was based more on an ability to pay than what it is right now. What we see in our practice, and this would be a second piece of legislation, but what we see in our practice is people that used to be self-employed, maybe farmers or tradespeople, as soon as they started working to a certain extent and they got to a too high income threshold, they lost their benefits now. Whereas before, that threshold was a little bit more lenient and their premium might just go up. If they made X dollars and then the next month they started making more, they still had coverage. They weren't completely kicked off. Then another piece that I think would be a really easy one is broadband. I think broadband in our rural communities, and I know that's a hot topic even at St. Croix and in Dunn County. Myself, for instance, on my farm, I live kind of in a donut that is, I don't have broadband service. I do at my office, so when this virtual learning really started to happen, a couple of my older daughters ran out of usage on their Verizon plan from their hotspot, so they're working out of our conference room in our back office here, just over the wall from where I'm sitting now, because on our farm, we don't have broadband. So especially, I mean, if anything's coming out of COVID, that would be one of the bigger infrastructure things I'd like to see. And I think, quite frankly, that's something that should get bipartisan support all day long. So,
well, considering that the candidates that I interviewed from on the Democratic side, as you put it, all agree that broadband is one of their top three priorities. Just curious, what's your thought on why that hasn't been done? If it's so vital to economic development and to education and just overall vitality of our state, why is there such a great need, and why has there been an inability to make progress on that issue?
Well, Jamie, I think it maybe wasn't as high a priority before. It's something that maybe people thought was a luxury or entertainment value, something for being able to stream movies or Netflix. But I think, once again, COVID has really brought that to the forefront. I think now people are demanding it. This issue where we only, in some areas, only have one cable provider that has complete control over the market is very limiting. For instance, in my office, I have the choice of two. That's it. Right here in the heart of Menominee, North Menominee, I have two providers for my internet service. So it is still pretty limited. I think there's been some time with the past two administrations, as far as the Wisconsin governor, where there's opportunities that were there, but there was something else that took precedence, or took priority, I should say, over it. So I think now is the time. I think people do see the value in that. Like I said, some of our rural areas, north of my farm, out in rural Dunn County, they're pulling in new lines. West Wisconsin Telecom 24/7, which serves a lot of Dunn County, is pulling out new lines, but I'm still going to miss that one because I've got a half-mile long driveway at the end of a half-mile long road. So I think starting with some of these issues that we can come together and put together bipartisan bills, I think is a good start. I think I'm a new, fresh face. I'm not a career politician. I'm optimistic. I'm thinking I can have a pretty good success rate working with the other side. Once again, the Democrats.
Okay. So, Clint, what are some of the other issues? You mentioned two right off the bat that you thought could get bipartisan support, but considering that both houses in the legislature are pretty strongly Republican, you just have to be able to get it signed by a Democratic governor. So there's going to be some work there. But what is it that you feel would be an area of focus for you?
Well, I'd like to see policies that are pro small business for our rural areas. So that would be another big kind of a broad area. But I'd like to see bills that make it easier and more attractive for businesses to want to locate to the St. Croix and the western part of the Chippewa Valley that I live in here. We've got a great opportunity with the Twin Cities Metro, has a lot of good education, a lot of good resources, and we have a good workforce here. People in western Wisconsin, and I'm not just saying this because they're my constituents, my neighbors, but they have a good work history. People here are hardworking, they're honest. So that's one of the areas I'd like to see, policies that are pro small business. In business here in Menominee, I've had a number of instances where I've been bogged down from something from a small sign ordinance or a setback ordinance. And we need to have public safety ordinances. That's not what I'm getting at. We have to have setback ordinances as far as making sure that our businesses are located safely next to intersections and highways. So I would definitely, there's a place for some of these, but some of them are overbearing. They're over restrictive. The other thing that I would be very much in favor of is anything that protects liberties and constitutional rights. Right now, obviously the hot topic is whether or not the mask mandate should be extended. The governor's mandate expires here on the 28th. A lot of municipalities, including Menominee, including St. Croix County Board, has taken this up a couple times. It'll be interesting to see what happens in the next week or two. But that's another area I'm very strong on. I respect and I know our Constitution well, and I want to make sure that I'm upholding those things that are spelled out for our individual rights in the Constitution. Okay.
What if elected, and I know you wouldn't take office till January, but I'd like to say that this COVID thing will be long gone by then, but it's not looking so much like it's going at that pace. So would you be somebody who would be in favor of taking it out of, let's say, individual communities and making it some type of state mandate?
I don't. I think more local control is the way to go on a lot of these issues. It just makes it more adaptive, because depending on what the rates are doing in various counties and communities, you have to have some local control to it. But I am very wary of anything that requires or mandates anyone to do a particular activity. So to answer your question, I'm not in favor of a governor or a statewide mandate. I think it should be left up to the locals, but even that I'm not in great favor of. You look at the death rates, look at the infection rates. I mean, obviously infection rates are going up, but the mortality rate in Wisconsin is not going up, especially when you look at in the last week since the college and universities went up. Very, very high percentage of the positive tests that are coming out are college students. Many of these college students are asymptomatic. I could name off 5 or 6 cases that I've had come through my office, or indirectly students of patients of mine that maybe are in other institutions throughout the state or in Minnesota. Some of them have no symptoms at all. Obviously, they're on a 14-day quarantine until they clear, but many of them are getting it and they're just not getting sick. If we're looking at herd immunity, the population that we want to have get sick is the college students, the young, healthy immune systems. So obviously, I'm concerned about public safety. For instance, I did vote on our reopening plan here at Menominee to require masks. That's something that's been thrown back and forth, is either you're concerned about liberty or you're concerned about public safety. You can't have both. I do believe you can have both. I do believe that people can make the best decision, the safest decision for themselves and their families.
Okay. So you mentioned the liberty and government mandates pro small business. So I would take it if there was a minimum wage statute, that's something that you would not want to see the state raising it.
I'm not in favor of that stuff. I mean, I think you got to do a little bit to keep up with inflation and cost of living a little bit, but I'm very much a free market guy too. I'm not a crony capitalist. I'm a big believer in letting the consumers decide and see value in services. Same with, for instance, in our business, I'll use my business as an example. I'm an in-network provider for just about everything, but nothing bothers me more than when I get a new patient that comes in and they say, I'm only here because my insurance requires it. I really like the guy across town or down the street. I believe that a person should have the choice to choose, if they like a certain provider, if they like to utilize a certain good or service, a business, that the consumer decides that. And we're not playing favorites with subsidizing, for instance, minimum wage.
Okay. Well, and speaking of selection of providers, it goes back to one of the issues you were talking about, any willing provider and just overall healthcare. It's looking that, like, for instance, with this issue on the Supreme Court, we're now getting a little far afield from state representative duties,
Yeah.
But there's always that trickle-down effect. So if the Affordable Care Act does get stricken down, so that way that there is no federal issue on that, leave it up to the individual states, that means then it will be squarely on your desk next year. So where would you come down with some type of program in which those people that are getting paid $7 an hour, $8 an hour, how would they be able to get health care?
Well, like I said, traditionally, and this was probably about 10 years ago, but our Medicaid system here in Wisconsin had a tiered program to it, or a subsidized built-in cost of living type model to it. So basically, if a patient or a consumer would make $7, $8 an hour, they would either be fully eligible and not have any type of premium. If they got a job where they were making more, and this comes up a lot with self-employed people, where maybe they have a good month and all of a sudden they're making more, instead of getting kicked off, they would have some type of coverage. Obviously, there'd be some type of premium. But one of the big things we saw as a provider with the Affordable Care Act, people were very excited for it at first. The general patient that came in, didn't matter if they're Democrat, Republican, a lot of them thought, this is going to be great, I've got coverage. And then as a provider, we many times got to be the bearer of bad news, because we had to tell them, yes, you have coverage, but your deductible is like $10,000 or $13,000 or $15,000. But it was very, very high. So I don't care, even if you're an individual that's making $12 or $15 an hour, and you come in and you've got a deductible of $10,000, and maybe you've got kids that you're trying to feed and a mortgage to pay and car payments and insurance, you just couldn't afford the Affordable Care Act. That insurance, people were insurance poor because the premium that was coming out of their paycheck was maybe affordable, but then when they actually utilize the services, and I can speak from like my services, or I have a friend that's a podiatrist, I have a couple friends that are dentists, and it was the same situation. When they came into my office, they were essentially a self-pay or a cash patient, because that $10,000 deductible as a chiropractor, there was no way that they were going to hit that unless they had something catastrophic happen to their family. So I do believe there should be a choice for an individual if they do want to carry like catastrophic or very high deductible insurance, much like a lot of small businesses like myself, my family of 6 would have. Other than that, for preventative stuff, we have a health savings account. We're paying for it out of pocket. So yeah, I do think that if that does happen where the Affordable Care Act goes away, I think we as a state legislature, I think we've got some pretty good options out there too, Jamie.
Okay, and so, but then who pays for that? So I was trying to determine,
Oh,
because
yes.
you
Yeah.
were mentioning about high deductibles, and obviously that means the consumer's paying for it. There's not a lot of point in the insurance if there's a
Right.
$10,000 deductible. But are you saying, how would a person that makes under $10 an hour, be able to pay for their health care?
Well, their deductibles would be lower. I guess I said premium, and I probably should have said deductibles. Their deductible would be lower, so it would make it more affordable for them. So obviously, there's money that's set aside in the Medicaid system, so we would have to be looking at where that Medicaid dollar is being utilized.
But would this be the employer that's paying that premium, or and keeping the deductible low?
Oh, yeah,
so that the
yep, I get
consumer
what you're
can pay
getting
that?
at. Yeah,
Yeah.
I think the employer would have to take some of it. It'd be nice if it'd be like a matching thing, like a 401k or a matching part where the employer kicked in a portion, the employee kicked in a portion.
But any role of the government in helping small business in that regard, so that small businesses could attract employees if they can't pay them $25, $30 an hour?
Yeah, I would love to see that. Of course, as a conservative, you're putting me in a very tight spot here, Jamie, because as a small business owner, but also as a conservative, I'm not in favor of raising a lot of taxes either. But we've got to do something to make it more attractive for small and medium-sized businesses to attract and retain good employees. Because that is one of the bigger challenges I've had over the last, I'd say, 10 years, is getting and keeping employees. Many times we have to have employees that maybe their spouse has a public sector job with good benefits, because as a small business, when we've offered insurance, we've had the majority of our employees not take our insurance because it's just not affordable. It's too expensive. So I do think you'd have to answer your question. I think you'd have to have some help from our state and local government basically to help make that easier for the small businesses, medium businesses, and the employees.
Yeah, right. I mean, some kind of sliding scale there,
Yep.
where the people that can afford it obviously are paying a little more, and small businesses can still retain employees. With that idea of free market and competition, would you be in favor of some kind of legislation that might require, before it was allow, and it really hasn't happened, so now maybe require more transparency in pricing by healthcare providers, so that an MRI in one place costs $3,700 and someplace else it's $1,150?
For sure. Now you're asking me a question that is right in my wheelhouse, so to speak, because I get EOB's explanation of benefits back on clients that we take x-rays for, and then it may be a non-local medical center. So it's not even like in our area here in Menominee, we have a lot of Mayo Health System and a lot of Marshfield Clinic or Security Health. So I'm not even talking about those two organizations, but we'll get patients, primarily students that come from another part of the state, or maybe they relocate to Menominee for a job, and I'll get an explanation of benefits back, and someone in the Fox Valley or down in Milwaukee or Madison, that provider down there is getting paid significantly more, in some cases double or 2.5 times what I would get reimbursed for something up here, same procedure. And to be honest, a lot of times I think I'm getting reimbursed fairly, but when I do see that another provider is doing the exact same thing and they're getting a different rate, that makes no sense to me at all. We happen to live in an area that's fairly expensive when you look at your explanation of benefits for insurance companies. And that is something I'd like to see legislation where it's more of a universal across the board. There's services that I do as a chiropractor, and because my license, I have a DC after my name, there's things that may be done in a medical facility, and they're getting, in that case, 400% to 500% more payment than we are. That's just not right. And there again, I'm not saying that I'm doing this for a raise for myself, that I need more, but why is it that, the same services are being billed and reimbursed at different rates throughout the state and throughout different facilities? That's an area where there could be a lot of cost savings for our insurance, for our state, for our taxpayers.
Okay, so one of the other traditional, one area that you haven't mentioned yet, but is being seen more and more by one particular party, and that is the law and order platform versus social justice, I guess, as if the two are completely separate or against each other. But when it comes to overall conservative philosophy and everything, Do you see where law and order needs some tempering when it comes to how we deal with our criminals and just not overcrowding our prisons and what that does to our taxes and, keeping, 40 to 45,000 a year for somebody to keep them behind bars?
Yeah, I do. And there's certain strategies that are out there that has been explored from more at the county levels in different areas throughout our state, from different programs and different, instead of just locking someone up, more of a, I guess, rehab or, I'm drawing a blank on the word right now, Jamie, but instead of just for the residual offender, there's other things that can be done. I think as far as law and order, and I know the Republicans, obviously that's a big deal for me. I appreciate law and order. I love our law enforcement. I think 99.9% of them do an excellent job, but it is like no other profession in the world, and that, or I should say it's just like any other profession in the world. There's some bad people that are in every profession. I think one of the police reform things that needs to be out there is a little bit more of an objective way of seeing what cops are bad. Are there bad cops out there? For instance, up in Minneapolis with the George Floyd, there was a couple individuals that had previous violations and previous issues that may or may not, should not have been on the street still practicing law enforcement. The majority of our cops here in Menominee, well, I should say all of them I've run into in Menominee, good guys. But I do think there's some more stuff that could be done to keep track of them. For instance, myself, again, as a provider, if I'm not on par with my peers and I'm not practicing best practices in my practice, I may get kicked out of network. I may lose my license if it's severe enough. So I think there's some legislation there that could occur. I don't think sending a social worker out on an emergency call is the first response that we should have with our law enforcement.
Okay. And finally, I guess, since you have school board experience, what do you see any issues that you would like to work on, whether it's across the aisle or just get higher priority within your own party as it relates to education?
Well, for the most part, I think, especially in the 29th up here in western Wisconsin, we have really, really good schools. Another thing that's come out of the COVID situation is I do think that there should be some choice for parents to take some of their dollars to follow their families and students if a school is not a good fit for them. And I know this one usually comes back, they say it's a Madison or Milwaukee issue. But, if a child has a learning disability or they're not getting their needs met with our public schools, and I know this may not be a very popular thing for a public school board member to say, but if there's a case where a child needs some type of specialized education or just an alternative, maybe they're getting picked on and bullied really bad in their school, and they've tried to work with their school and it's just not working for them, there needs to be school choice to some extent. I do think a portion of the taxpayer dollar needs to stay in the local district, but I think some of that money should follow the child as well. So I know you asked me what could be improved. Locally, I think, like I said, I think our district here in Menominee is very, very good. One of the things that probably was most disappointing to me as far as a school board member is the lack of policy creation or lack of flexibility that we have, or the ability we have to create policy. As a local school board member, I can't have as big an impact as I can as a state assembly rep. I think as a state assembly rep, I can have a lot bigger impact on our schools and our communities.
Well, we talked a little bit off camera about how schools are funded. Is that something that, again, you would look at revamping at all? Because those equalization aid and there's tertiary aid, and it's a highly complicated formula, that seems to turn some districts like our Hudson School District, which is not in your area, but still where we our portion that goes to from the property taxes probably doubled in the last 20, 25 years. So would you see some traction in the state legislature for trying to find, better options for funding of schools?
It is, and this comes up quite a bit. I mean, our funding formula right now is very, very complex, and that's probably the most, I shouldn't say interesting, but probably the most challenging thing I've learned as a new board member, being on there for a couple of years, is our funding is very, very challenging. Menominee does quite well with the current funding formula that's out there. You mentioned like Hudson, for instance, which is perceived obviously a little bit wealthier community, a little bit higher, better tax base probably than Menominee or Dunn County. So to come up with a way that's kind of a blended or fair way for everybody would definitely be on my radar. It's one of those things I've seen some schools, because we have other schools in Dunn County that struggle with that formula. And their tax base is not very good either. So I would be all over it. One of the committees I'd like to serve on is college and universities, for sure. And anything to do with education and helping our communities out in that aspect is very, very important, because we need a good educated workforce. We need kids that are ready to face the challenges of tomorrow as best they can and adapt to whatever might come their way. I mean, if anything 2020's taught us, it's we need to be able to adapt. So.
Very good. Well, unfortunately, we're out of time. I'd love to be talking to you for more time here,
right.
but if you could, Clint, can you give our viewers either a website or Facebook page or some way that they can learn more about your campaign?
Yep, best way is reach out to me on Facebook, Clint Moses for WI 29th, or you can email me, or I should say go to my website, which is moses4wi.com, or Facebook, Clint Moses for WI 29th. Email me. I'm very approachable. I'm available. Obviously very, very busy these days. I am still practicing in the mornings and getting out and meeting all kinds of new great people in the afternoons and evenings and weekends. So sleeping about 6 hours a day, but I'll do what it takes to work and represent all of our people in Madison. So
I remember those days. So I was going to ask about, as far as campaigning in light of the COVID and everything. So you still are doing door to door?
Oh, it's been very challenging. It's a whole different perspective. Basically, you knock and then you step back about 10 feet and you carry a mask with you all the time. So I'll meet people wherever they're at, whatever they're comfortable with. And it's much tougher because there's no large groups, obviously. There's not the parades, the fairs, where I'd love to get out and talk to people. One of the main reasons I do what I do, I got into being a chiropractor, is I love being around people, love talking to people, love helping them with their problems. Same thing goes for this whole political aspect as well. I love getting out and meeting people, and it's been a challenge this year for sure.
Well, thank you for coming on the show. Appreciate talking to you. Good luck with the campaign. I guess we have about 6 weeks left or so. And we will also want to thank our viewers for watching another segment of Western Wisconsin Journal. I encourage you to get out there and vote. And if you can vote early, please make sure that you get your ballots in early if you are going to mail them. So with that said, thanks, Clint, for being on the show.
Thank you, Jamie. It was great.
And thank you for watching another segment of Western Wisconsin Journal.